you know, I've heard all the things you have about Michael Moore and about his ability to tell the truth and all those kinds of things. And I kind of poo-pooed my friend. I said, so what? What good does that do me? What in the world is that going to do for me? And she told me she thought I should send an email, and I didn't. And she called me back a week later, and I said, you know, just to shut you up, I am going to go on that website and send an email. And I did. And I sent one that was kind of terse and angry and said, when you're working on this great film about health care, why don't you talk about what's happening in the middle class in this country? People who've worked all their lives and lost everything they worked for simply because they got sick. And you know the rest of the story. If you saw Sicko, if you haven't seen Sicko, then you can see it. I ended up going to Cuba with Michael for some health care at the very end of the film. And then about a year later, I was blessed enough, I tell people I'm the blessed one from Sicko. I was hired by the California Nurses Association to now advocate and write and speak on health care reform. And the nurses advocate for a single-payer system. For those of you who don't know what that means, and I know there's only a few of you, but the rest of you who do, bear with me for just 1 second. It's a really easy concept. It's so simple. It takes a good idea from the left, which is public financing, puts it with a really good idea from the right, which is private delivery, and pulls it all together into one plan, single-payer. You still choose all your own doctors. In fact, you get more choice. You choose. The insurance company doesn't choose. You choose who you go see. That's what HR 676 does. So if you have a chance, get on and read it. There's some other things that public financing does for us that we're really watching unfold in our economy right now. And I want to wrap up because our other speakers have to speak too, and you can ask me some more questions later. You know that there's a lot more people losing their health insurance benefits right now because they're losing their jobs. Well, having a system based on employer-based health care benefits, how faulty is that? When we've got this terrible system that's, you know, we've got a lot of people losing their jobs, a lot of companies, even very responsible ones that would like to provide health insurance for their employees, can't do it in a meaningful way because it's so costly to them. If we go to a single-payer system, it will relieve a lot of pressure on a lot of American companies and allow them the freedom and the opportunity to compete, really, on a more even keel. I've got some, if you know an organization called Healthcare Now, you can learn about how much it would save our county, and our state governments. And thank you so much for being here to learn about this. As you may know, budgeting for them has become a nightmare based on legacy costs for employees they have to cover. Many have to encumber $1 million per employee. That affects bonding for your cities. It means you can't get roads, you can't get potholes fixed, your schools have to lay off employees. You watch, it's happening. And if we're not tying that to healthcare, we're making a disservice to ourselves. So the Cal nurses, we have this great piece called One Nation, One Health Plan, because we believe we all deserve health care. And we're also doing a number of things with the Leadership Conference for Guaranteed Health Care, including we're going to be comparing state plans. And we're doing a briefing in Congress on Wednesday. You're all invited to come or send your reps. In fact, call your rep that didn't come and didn't send a staffer, and have them send someone to this briefing that's happening in Rayburn at 2 o'clock, Rayburn House Office Building, 2 o'clock Wednesday, and room 2226. You learn it's an informational comparison of state plans that have been tried and failed. And the latest plan we're going to look at is Massachusetts. We have people coming in to testify on that. We're going to learn together. We can do better than this. We're better people than this. And I'm going to close with one thought. I'm in Washington now. The nurses have moved me to Washington so I can officially visit all my reps up close and personal and advocate a little more closely. And I'm sitting and listening to a couple of things congressional staffers have said that are somewhat troubling. I heard someone in Senate Finance, this is Senator Max Baucus's committee from Montana, talk about how they'd like to have a plan that would have bronze, silver, and gold level coverage. Okay? Now, if you listen to our new president, President Obama, say that health care is a human right, how do we reconcile that? How do we tell some people in this society they're bronze level human rights? Some of you are silver, and some of you are gold. I can't do that. Then I was sitting and listening to a staffer for Representative Waxman, who's also quite powerful in the Congress. And he made a comment when we were talking about single parent. He said, this is not a time to be aspirational. And I said, really? What was all that hope stuff? What was that? So this is the time for us to speak up. We have to speak up. We have to get louder. We've got to tell them what we want. They are our representatives. We pay for them to have good benefits. And you hear people say, well, I just want what they have. I want to tell you what they really have. Not only do they have access to better benefits than their staffers do, when I walk through those House office buildings and the Senate buildings, guess what's there? A medical office. If they don't feel good during a session, they go in the medical office and they get cared for. They get treated, and guess who pays for that? We do. We deserve to have health care. It's a human right. We deserve it. Thank you very much. I hope to answer your questions and talk to you soon.